Good morning. This is Steve Stites, Chief Medical Officer here at the University of Kansas Health System with Hawkeye, broadcasting live with you today from the Dolph Simons Family Studio, and we're delighted to be back with you. You know, every day I say we've got some really special guests because we do, and today is no exception for just how special folks are to be on our program. Scott and Shannon Brugge, I'm going to say it right, Brugge. I got a little code down here. It says Gee sounds like key. I could do this. Brugge are with us today. They went to LMH Health, and they're going to be talking about surviving COVID-19. They had a couple of really great docs, and I know one of these folks really well because he trained when I was a faculty member here as a fellow and as a resident. He was a chief resident back when I was a program director. The pulmonologist's name is Dr. Krishna Rangarajan. Krishna, what's up out there? How are you doing today?
I'm good. How are you, Dr. Stites?
Good. And for anybody that knows Krishna needs stories, I've got stories. So if you ever need anything, just come find me. I'm happy to help with that. He is joined by infectious disease specialist Dr. Christopher Breiche, who's also with us. Dana?
Hi.
How's the day look?
Yeah. Hi, Krishna. Krishna and I went to school together.
Yeah, I know. We were talking about, what a great class, 2005.
Well, he was much smarter than me since he was a chief resident. So the numbers are better today. 27 in the hospital for acute.
Down from 36.
Down from 36. 6 of those in the ICU, but 4 of those in the ICU are on the ventilators. So
okay.
So that number did change then. We do have now 32 rather than 26. That meet that criteria for recovering. So
okay.
COVID recovering, that we don't have in isolation and don't count towards our numbers, but they're still in the hospital. They came in, they
because
had COVID. Yep. So they are still here. So it is 32, and then again 26 on the acute side with acute COVID.
So, I know a lot of people raised concerns yesterday about how the CDC was saying only 8% of people that died of COVID really died of COVID. And that's just an inaccurate portrayal of what that data says. Let's just be honest.
Yes.
Don't fool yourself with that, because that's just wrong. The reality is that people who died of COVID would not have died had they not gotten COVID. These are people who get COVID on top. And that's true for any disease. If you get an insult to your body on top of something that's pre-existing, you're going to get sicker. It just is that. That's just how we are wired. It's just how our bodies are, right? And that's why as you get older, you're more at risk from infectious diseases than when you're younger, because you tend to have more underlying conditions. And so don't delude yourself and make yourself say, see, nobody really dies of COVID. Yes, all those deaths who died of COVID died of COVID. And the fact is that what happens is that, as with any infectious disease, or really a car accident, or if you're a burn injury, or if you got a heart disease, if you've got an underlying disease, it's going to make things more serious. And it is certainly true that most of the people who have died of COVID have underlying disease. That's a true statement. But they still died of COVID, and they wouldn't have died had they not gotten COVID. And that's how we have to look at it.
Yeah, and they did try to clarify as well, saying COVID was the only cause on these death reports. But on the 94% of the other death reports, it was COVID and obesity and diabetes and heart disease.
Unfortunately, in my life as an ICU physician, I've had to fill out a lot of death certificates. And it's an imperfect science, but you list the different things that contributed to somebody's death. So if you have underlying heart disease and lung cancer and you get COVID, the reality is you died of COVID, underlying heart disease, and lung cancer. And that's how those things get filled out. And so the key is you don't want to get COVID, because then you'd probably live a lot longer. So that's how that works. Okay, so Scott and Shannon did an interview with KDHE Secretary Dr. Lee Norman. That's where we first heard that story. We want you to listen to this short excerpt first, so we're going to start with that. Let's hear that story.
It was 30 days I was quarantined from the time we were notified that he was positive, and obviously the longest days were dropping him off at the hospital and being told to go home, and that they would reach out to me, and that phone call that your husband is on a ventilator in ICU and you can't be there with them is just gut-wrenching. It still gets a reaction out of me, and I called the hospital every day and they were absolutely wonderful. I checked in at every 12-hour shift and got updates. But, all I could do was be Scott's voice and reach out to his family.
And I think everyone just has to understand that we're not through this, and the numbers show that. And at some point, the laws of averages will say you may have this. And God forbid that anyone has to go through what I went through. Again, I consider myself lucky. I know the statistics weren't with me on coming off that ventilator, but again, I'd hate for someone to have to go through that and unfortunately have to pass away from that.
Powerful, powerful words. Scott, how are you feeling now?
I'm doing a lot better. I'm doing pretty much everything I was doing before. So very blessed.
Awesome. When did you first get sick?
It was mid-March, I believe around the 15th of March. Started coming down with the symptoms. Again, it was still pretty new, so watching stuff on the news. Again, the cough, the low-grade fever were two of the main symptoms at first. Later in the week, it became pretty much all the flu-like symptoms. I lost my taste and smell. Had higher fever, diarrhea, vomiting, aches, chills, all the above. And then it just progressed into my lungs and started having that shortness of breath. So it was about 5-6 days before I got the test results back that I was positive. And 2 days after that, she dropped me off at the hospital.
So Shannon, did you ever test positive?
I did not. I was considered positive at that time. They weren't doing as many tests or availability. I was told by the health department that I was positive.
So you may have been positive, but we may also not know because you couldn't have been tested. That's tough. Today we would test you to know and to see, and so that had to be really hard to watch your husband go through that. Scott, how did you get it?
Don't know. Still don't know to this day. I don't know if it was here. I did travel in February, so trying to put the timelines together. I just don't know.
Yeah, unfortunately, we often don't. Dr. Rangarajan, I used to just call him Dr. Krishna. I can say it a lot easier. How did things go how did these things go for these good folks, and how concerned were you?
Well, when he got here, we weren't involved in the first day of his care. The hospitals were taking care of him. He was just on a couple liters of oxygen. And through the course of that first day, just needed a little bit more. And then that night, unfortunately, as we sometimes see with these folks, they suddenly decompensate. And he went from just needing a couple liters of oxygen to being basically on a non-rebreather and still not being able to keep his oxygen up. And so he was intubated by the emergency room physicians in the middle of the night or early morning. And then it was a slow recovery from that point in time. He needed a lot of vent support, a lot of high PEEP, a lot of high oxygen, and it was just a slow recovery. Took about 10 days on the ventilator for him to start to slowly improve. That's how it started anyway. It's a pretty sudden shift in how someone's doing as far as their oxygen goes.
So really, that's a patient population who, in general, carries a very high mortality rate. Once you're on the ICU and you go into a ventilator and you require a lot of oxygen and PEEP, that's a ventilator term. Sorry, a lot of pressure from the ventilator to get the oxygen into your lungs. And so, when you're in that setting, Dr. Rangarajan, what did you talk to? What did you say to the family? What did you say that you thought his outcome was going to be?
It's interesting with everything that was going on at that time. It was such a change for all of us because, we're used to having in-person, face-to-face family visits, and every time we're in the room, we're talking to a family member and kind of updating. And so it was kind of a paradigm shift for all of us just to be doing family meetings over Zoom with his brothers and his wife. And, a lot of it was about, we were basing it off of, what we had seen from overseas and in New York and everything that was going on. And the realities of the situation, unfortunately, are fairly grim as far as, like you said, once you get on a ventilator, patients don't do great. Our hope was that his age was in our corner, and we just needed to try to support his body as best as we could. We didn't, that was 5 months ago, and so we didn't have the therapies or the studies that we have now to kind of help guide us a little bit better. And so it was a lot of talk about, how are we doing every day, that our goal right now is just to kind of keep him stable and start to slowly work his pressures down and see his oxygen stabilize. And we were fortunate that really we didn't see any other organs being affected by COVID. We didn't have any of the liver dysfunction we sometimes see or the renal failure that often happens. And so it was really the lungs were the main issue. And as we were getting towards day 7, we start talking about, okay, if this continues and we're not making progress, we start having conversations about, okay, where are we on do we talk about tracheostomies and things like that? But then he started to make some improvements over those next few days to the point to where after a day or two after we brought that up, I said, well, I think we can kind of push those conversations to the side for now, and then he just slowly continued to improve. And about 10 days after he went on the ventilator is when we were able to, as we like to call it, liberate him from that ventilator.
And indeed, it's liberation. I'm going to say this, Doctor, is it Bryce Shell or Bryce Shee?
Bryce Shell.
Bryce Shell. Okay, see, I didn't want to completely butcher it for the rest of the media session and then have to apologize to you later. So
that's okay. No worries.
So what were your thoughts as you worked with Scott about how this was going to go, and then how are things in Lawrence now?
Initially with the case, it really brought to light. I mean, you hear a lot of media stories, and the severity and potential severity of it, but it really brought to light where just, once the disease course sets in, just truly how detrimental it can be, and kind of an absence of tools to utilize that are directed at the virus itself. I know, now we have access to remdesivir, convalescent plasma, but there really wasn't a whole lot outside of supportive care and trying to look for secondary complications. And so it was a very eye-opening experience. Not that it needed much more respect, but it certainly was very eye-opening in the sense of really once the disease sets in, the cards are kind of dealt, and we do our very best to support the patient as best as we can.
Yeah. So how are things going now in Lawrence? Are you nervous about the university and all the positive cases we're seeing?
The school year will be interesting. So we've certainly seen an uptrend in cases. We're somewhere just shy of 1,400, depending on where you're looking at your numbers, but Lawrence Douglas County Health is somewhere around 1,375. And that is a vastly different number than where we were a couple of months ago. A couple of months ago, we were in the single digits still. And then we had some expected upticks in caseloads as we went into phase 3 reopening, and things that seemed to correlate with bars reopening. And our health officer, Thomas Marcelino, he instituted masking that was mandatory, and then the bars closed, and we saw the numbers kind of plateau and actually go down. And then around the time period of students moving back into the Lawrence area, we did expect with increased testing, and it's quite the undertaking, as I can only imagine, that we would see an increase in numbers. But we certainly are seeing a sharp uptick in cases, and I think out of that roughly 1,400, I think 800 of the cases come from the 18 to 24-year-old demographic. And so it's still a concerning trend. I think that, as aggressively as we can to continue to screen, quarantine, isolate, the non-pharmacologic interventions of masking, hand hygiene, all those things are going to be just crucial to having a school year and for the health and wellness of the community.
You bet. Well, good luck with that. So Scott and Shannon, how long did it take you to get better? You said you're feeling good now and you're back to baseline almost. So how long did that take?
Yeah, it was a process, probably a month before I really started feeling like I was getting back to my old self. And, just the biggest thing, again, I've never had a major illness, never been in the hospital before. So I didn't realize what that did to your body, just the atrophy from muscle and loss and all that. Walking was a challenge at first. And so every day when I got home, had some home health care, but walking, trying to do a little bit of weight. I lost a lot of muscle in my upper body, and it was just trying to get back a little bit so I can do the day normal stuff, shower yourself, help with the groceries, cook, all the above. So I would say a month before I really started getting back to somewhat normal.
And that, I just want to tell you, as the old ICU guy, that's really fast, because I think Krishna would even, Dr. Rajan would say, man, this could have taken you 3 to 6 months when you've been on the ventilator and been that sick. So a month is great. And Shannon, still, that's a long time. You had to be nervous watching your husband and thinking, gosh, what's going on here?
I was just so happy to see him. I told friends I was kind of like a puppy dog. I just wouldn't leave his side, and of course I wanted to dote over him and get him things. And he just said, Shannon, you've got to let me get up and do some things. I got to keep moving. Being away that long, we were just so excited to be with each other, and I wanted him to find his independence, but of course I was nervous and cautious about him overdoing things. But we were just happy to be together.
Yeah, well, gosh, I'm glad you guys are together and able to do that. That's awesome. Well, Jill, let's see if there was questions from our media this morning. Not hearing any, so let's turn to our listening audience. Listening and viewing audience.
That's right.
Yeah. Okay. So Quinn wants to know what you think about herd immunity that's been in the news recently, and are we going to reach it? Is it a good thing?
I think herd immunity from acquiring COVID-19 is a particularly bad idea. Yes. And in part because, if 1% of the population is testing positive currently and maybe 8 to 10% of the population have had it, that means 90% of people really haven't had it. And that just means that's a whole lot of death. We've already had 186,000 in the United States. So if you took that times 10, that's 2 million. That's a large number of people. That's just a lot of people to watch pass away from COVID-19, and that would be tough, I think. And so I would say that's a bad idea. Plus, with the questions about whether or not you're going to get the disease again after 3 or 4 months, that means you have to get herd immunity again every 3 or 4 months. So let me just ask Scott. Scott, how would you feel about having to get COVID-19 every 3 to 4 months to maintain your immunity? What do you think? Is that a good idea?
That's laughable. Just hearing that, it just does not make sense. And again, I went through it, but my wife, obviously went through a lot more, having to go through and seeing and hearing about the condition I was in. So if people understood that part of it, they wouldn't want their family members to go through that for sure.
Okay, Shannon, so you're thinking that idea that everybody should just go out and get COVID and have herd immunity, that's a bad idea. Is that what I'm hearing?
I would have a lot of choice words that I'll refrain from, but that's pretty terrible. I mean, at the end of the day, this is all somewhat the ball's in our court. And stay at home, love each other and your family, and know that you can kind of protect yourself in your home environment. Don't go out and be in large groups. I mean, just be smart about it and consider everywhere you go that every person walking near you has it, and you'll be extra cautious, and you'll be with your family, not have your loved one in the hospital while you're at home wondering if you're going to see them again.
Yeah, Dr. Breischel, I'm guessing you'd agree that it's a terrible idea. Is that accurate?
Correct. And the example I usually like to tell patients is that, the numbers we usually think about for herd immunity is about 40 to 60% population exposure for a novel entity. And if we use New York as an example where things were on the brink, they were batting somewhere around 15, 20%. So if we imagine that on 2 to 3 times the scale, it is just a non-sustainable option.
It's a terrible idea. I mean, it's okay to get there, I think, Dana, with the vaccination.
Yeah.
I'm all good about that.
Yeah, that's a good point. So I think herd immunity from vaccination is very good. I think herd immunity from the actual disease exposure is not a very good idea. You know, if we look at the Johns Hopkins website, they typically have a case fatality rate of COVID of about 5%. It kind of moves a little bit, but it's about 5%. So if you think about really traditional herd immunity really stems from about 90% of the population or more having it. Because if you have 70%, you still have 30 that are susceptible to the disease. So if those people are getting the disease, if we are trying to work towards 90%, you either get it or you die, so you're no longer susceptible. If you have 5% of the population in the case fatality rate, that's a lot of death. Not to mention just the overall morbidity of people going into the hospital, not being able to perform essential duties, overwhelming the healthcare system, all that stuff. So getting to herd immunity by natural infection is probably not the right way to go. Vaccination is something different entirely. And then you brought up a good point. So what happens when we do experience not reinfection, but we are re-exposed to the virus? What happens? That is another question we don't know the answer to.
Exactly.
One of the people that was exposed had no symptoms. That's good. That means, hopefully, that our immune system is acting as it should and tampers it down before you have symptoms. But there was this other gentleman in Las Vegas who got it a second time who seemed to be a little bit more ill. So we are still learning about the full immunity to this virus if you're re-exposed a second time. So I think looking for herd immunity through natural infection is going to be very dangerous. Through vaccination will hopefully provide a little bit more stability, security, and overall less disease.
Yeah. Don't be dumb. Don't be stupid. Let's not get herd immunity by just trying to run out and get the virus. Bad idea.
Sammy and Mark want to know with the Brugge's how people around them treated them and if they've changed their behavior.
What a great question that is. Shannon, Scott, have folks treated you differently?
You know, initially, yes. Again, we were very cautious, and we didn't allow anyone in the house. So when someone would come over, bring groceries, we would make them, drop them off at the porch and wave through the formed glass window, that kind of stuff. And eventually, as summer got along, we would sit outside, space out in lawn chairs and talk to people. Again, it's nice to be around family, friends. The hugging and stuff like that, obviously we weren't ready to do any of that. So we've been very cautious, and I think everyone's respected that. And again, when there would be a function or a gathering, we did find a lot of things to go to. And I think that was tough. But at the same time, as you mentioned earlier, I don't want to go through this again. I want my wife to go through anything like that again. So we're just being extremely cautious. But everyone's been very respectful. And I think the other part, or the other piece within that is, I think everyone, when they heard what I had gone through, and I heard a lot of people say, you're the only one I know that has had COVID-19. And you probably saved some lives because I was more cautious hearing your story. And that, from my side, I think helped a lot of people understand they do need to hand sanitize, wash, good hygiene, wear masks, be careful, do not go out in large.
Yeah.
And hopefully that stuck with a lot of people.
And did you say wear a mask? Let's say that again.
Wear a mask, everybody.
So Shannon, when you see people not wearing masks, what's it make you want to do?
Is that a loaded question? I work at the criminal department in Douglas County. We require everybody in our office to wear a mask. I am an overshare, and I share with all of my clients that this is real. It's out there. I share my husband's story because I feel like once that becomes personal, and they're like, "Oh wow, you work here, like this was here," and I absolutely it's here. So I think it's important to put people and stories out in the community, share it. You have to. When we started to do that, we got a lot of personal messages, other friends, family, coworkers. or, hey, my boss had it. So it just opens the door for more people to share and put it out there, because I think there was a little bit of a stigma at first.
Yeah, there is a stigma. And Krishna, what do you say to your patients when you see them back? How are they doing after they've had COVID-19, and what do you do to tell them to stay safe?
You know, it's a mix. You know, I've had some patients who are still not quite back to normal even a few months later. I have some who, like Scott, are doing better. And I just, you know, spread your story. But I mean, the main thing I tell people is, you know, we've got to wear these masks. We've got to try to keep our distance from people, avoid large groups. And I mean, the reality is, you know, we're all ready to, we wish we could be done with COVID. We wish we could be getting back to what we're used to taking care of. And we all want this story to be over, but we've got a long ways to go. And we've all got to stay safe, and we got to keep each other safe. And I think that's the big key, is that a lot of what we're doing is not just for ourselves, but is really just to try to keep each other safe. And I think that's the best message we can try to spread, is that, look, you're not just doing this for yourself, you're doing it for everyone around you. And I don't think there's anything more as a human we can do for each other than to try to keep each other safe.
Yeah, I think that makes great sense, and I totally agree. Okay, Jill.
Jennifer wants to know if the doctors think that our overall COVID metro numbers are starting to level off, or is this trend still increasing?
What do you think, Dana?
You know, I have not looked at the overall metro numbers. Certainly, usually I go to kansascity.com, which includes, you know, the core four, essentially. The last 2 days on the 7-day rolling average, certainly over the weekend and on yesterday, it was increasing, but there were a couple days last week that it was decreasing. So I think that is a question about variability, and we have to continue to watch those numbers. Again, some of it may be a delay from the testing from the weekend. There may be other delays with the county or the state where they're getting their information from. So, but the last, you know, over the weekend and into Monday, there were still a lot of cases. The overall 7-day running average was still kind of increasing a little bit, not from where we were a couple months ago, but still on the increase. So I think it's just a matter of watching that 7, 10, 14-day running average.
Yeah, I think that's right, and I think the real key will be the uptick. You know, we know that Atchison, Douglas, Riley, and Ellis counties are hotspots for the United States at a county level. And all are really where schools are opening, and at least 3 have major colleges there, and obviously Benedictine colleges as in Atchison County. So I think when you look at that information, it makes you a little nervous about, are we seeing emergence of another spreading that's going to go out? Because all these, usually these events start with a couple of places, and then it kind of goes out from there. And I'm a little concerned about going out, and of course in Missouri, Columbia is a hot spot, and Boone County, and then others, and so I think Greene County. So when you see that, you get nervous that really we're going to see another crest as the wave rides up a little bit.
Okay, Wyatt wants to know more about the demographics at LMH. Like, who is it that's getting sick? Race, age, and sex.
All right, Dr. Breischel.
Any deaths.
And, how many deaths have been in there at LMH? And tell us a little bit about the patient demographics and characteristics that you guys are seeing in Lawrence.
So in general, in Lawrence, we are seeing the predominant number of cases coming from younger age group, 18 to 24. And then if you tie in up to age 32, that almost encompasses 70% of the cases in Douglas County. As far as patients that are admitted to LMH, we typically tend to see patients over the age of 50 for the most part, but there have been exceptions. Unfortunately, we have seen 6 deaths from COVID at the hospital, 8 in total for Douglas County.
So hard. Much of a difference as far as racial or economic or ethnic makeup in the number of patients there, or the types of patients you're seeing?
Yeah, so it's been a 50-50 split as far as male to female, or pretty close to one. Predominant number of cases are coming from white patients, about over 50%, with other demographics split up relatively evenly from there, but largely younger white patients with equal gender distribution.
Okay. All right. Krishna, how about the ICU? How's that been looking to you?
I would say, we had that initial bump around March, April, and then we kind of had a lull, which was nice. But the last month or so, we've been definitely the busiest we've been since all of this started. We've been fortunate to actually, I don't think we've had anyone ventilated who needed a ventilator since, I want to say, April or May. Probably May actually, but still needing quite a bit of oxygen and a wide variety of ages, nursing home ages to 50, 60-year-olds. Still a lot of people in the hospital, and I do think that's one of the things that's obviously different that you guys have seen too, is that even the younger folks who end up in the hospital, they're often being discharged needing oxygen at home, and that's just not something we see. And I think the morbidity from this disease is also something worth talking about, as far as how many people are needing oxygen for time, going home, having to stay off work for quite some time, and just and I think as we all know with ARDS that we get from COVID, there's a lot of downstream effects that we just remain to be seen just from prolonged times on the ventilator and things like that. But fortunately, we have not had anyone back on the ventilator in a little bit, but some of that is due to when it cuts to a nursing home.
Mm-hmm. Dr. Raingeorge, I think that's
population that's there.
Yeah, that's a great point, and we're seeing the same thing, Dana.
Yeah, and I think to your point initially about in the hot spots in Kansas, the silver lining is unfortunately there are a lot of cases, but they are a majority young people. Majority of the young people do well, certainly have less risk for going into the hospital. But we know, even in those communities, even if it is a majority of the infections are in that younger age group, it can reach those older vulnerable populations as well, and that's the scary thing. So.
All right, Cody, who's a reporter, wants to know what the Bruggees would have to say to non-believers.
Okay, Scott and Shannon, what would you say to the non-believers out there? I know what I would say. Believe, baby, believe. But what would you say?
I would just reiterate kind of what Scott had said. Most of us live in a world that until we've walked in somebody's story, and all I can tell you is, we are pretty average folks that work, enjoy life, enjoy our friends and family, and healthy and happy, and on a dime, our lives were changed because of this virus. And my husband could not be sitting here today, and I didn't watch the news at all while he was in the hospital, and I'm thankful I didn't, knowing what I know now about ventilators and the probability of him coming off. But I would just say that everybody should pay attention to what the doctors and the CDC is saying. There's a reason that you all are doing this broadcast every day, trying to share this information, because it is real. I am not being paid or given perks for sharing the story. It's because we're human beings and we want the rest of mankind. This is affecting the entire world, and this is real, and it is here, and it's not going away immediately. And just heed what everybody is saying. And I pray that none of your family is affected. But as Scott said, it's kind of a roll of the dice. I think we were being very cautious during that time, even at the early cusp of it. And one of us, myself or him, brought it home, and he became very sick from it. I would just say it is real, and we're the faces of it, sharing our story.
Scott?
I would say I have a $500,000 doctor bill that tells me it's real.
Those are two actually perfect perspectives, because it takes an emotional cost. It does take a big economic cost too, right? I mean, you can't get back right to work, you can't earn an income, and so it's funny, we all have, I call it cows, we all have a case of the cows, the COVID weariness syndrome. Yesterday was really bad. I don't know, everybody I knew had really bad cows yesterday. And yet, man, it's real. And all you have to do is look in the eyes of the family or patient to know the toll that it takes. And the toll is real.
Renee wants to know, on the second time around, being non-symptomatic, are you contagious?
Mm-hmm. Yeah, great question.
It is a great question.
You know, we think so and assume so. We don't know for sure. Those are some of that is one of the questions and others that we are going to be trying to answer in these next few months. So that's a very good question. We do know from a small rhesus macaque, again, the rhesus macaques are used as one of the animal models for this disease in humans, that when re-challenged a few weeks later after initial infection, they did not get symptoms, and they also did not have a viral replication as they did the first time. But again, we do have human biology. There are differences. There will be outliers in patients and how their body reacts to the infection the second time. So that's a very good question. Right now, we have to assume that you are still able to spread the disease, even if you get it a second time and have no symptoms. But we don't know. Hopefully, in the coming months, we will have a lot more information about that.
Well, Scott and Shannon, final thoughts for today for our listening and viewing audience that you would like to have people know.
Well, first, thank you to all the doctors, and especially the two guys at LMH for the care they've given to me and my wife during this whole ordeal, and all the obviously nurses and caregivers at LMH. We're so blessed that they took such wonderful care of me physically, but also my wife emotionally through that whole process. And Dr. R, whether you know this or not, your name comes up often in our household, and we just love you for everything you've done for me and for my wife, and appreciate everything from that. And again, my message, I guess, in final would say, guys, until we're out of this, until there's a vaccine, wear your mask, social distance, wash your hands often, sanitize, treat pretty much everyone that they may have this, and I think we'll get through this on the other end. So that's just, again, love each other and pray as well.
Yeah, I don't think I could say it much better than my husband does. And Dr. R, if I could reach through this camera, I'm a touchy-feely gal. I would give you a big old hug, and I can tell that'd probably make you a little bit uncomfortable, but you were very open and honest. You didn't ever give me false hope, but you didn't take mine away. And I remember a conversation where I told you I was praying for you and the doctors there, and we will continue to do that. We are people of faith, and we will continue to pray for our country, the world, and all the doctors there. And I just am so thankful and grateful that I drove him to Lawrence that day. There was a reason why we chose that hospital. Thank you.
Well, and you did. You got a pretty special team there. I happen to know the ID docs and the pulmonary docs at LMH really well. They're great. And I have to be nice to Krishna. He's a really great guy. And I worked with Krishna for a lot of years, and what a terrific doc. Krishna, final thoughts?
I guess my final thoughts would be a couple things. One, to Scott, and it's nice to hear your voice and to see how good you're doing. And also, number two, Shannon promised me when all this is over a big bear hug from you, so I'm going to hold you to that. But my final thought is, the reality is we are all tired of this. But you know what? We've got to keep each other safe. We've got to do what we can to help get through this and hope for a vaccine that works well and is and protects us to get through this as best as we can, and to save as many lives as possible, and to prevent the disease spread as much as possible. So please just wear your mask, use good hand hygiene, avoid big gatherings, and let's try to all get through this as safe as possible.
Dr. Breischel. Gosh, I got it right. Breischel.
First, Scott, we're just thrilled that you made it through this, and very grateful that you are talking to the public about your experience. We think it is an invaluable lesson and very instructive. I think that Scott and Krishna both said it very well. Our best defense at this point is prevention. So masking, hand hygiene, staying home if you're sick. Those are our mainstay. I know a lot of people are tired of COVID, but COVID's not tired of us. And until we get a vaccine, we really have to maintain our diligence.
Yeah, so true, Dana.
Yeah, absolutely. I can't say it any better than our guest did today. I mean, they touched on so many points, the emotional aspect, the physical aspect, the economic aspect. Unfortunately, we're moving into 7 months now in the United States experience with COVID-19, and we still have people who feel that it's a conspiracy and it's not real. And you just look at these providers, you look at these patients, and you understand that it is real. If you look at from the purely economic standpoint, look at all these businesses that had to close down. Look at the economics behind the NBA and the NCAA tournament and the NFL. There's nothing more that Clark Hunt and Mark Donovan want than everybody to be filling Chief Stadium. There's nothing more that we want than to be filling Chief Stadium. But right now we can't do this. This is a real thing. The nice thing about living in the United States is we have so many competing interests that keeping secrets and conspiracies really don't go very long, because there are so many people that could get a leg up from exposing those conspiracies. This is real. We had excellent guests today. Their messages are right on point.
Yeah, they are great. Tomorrow, Selena Geyer, who's one of our outstanding allergy, immunology, and rheumatology fellows, will be on the program, along with Keith Sale, who does that kind of work as an ear, nose, and throat surgeon and is also our VP of ambulatory. Is it ragweed or is it COVID? We'll talk more about how to tell those two apart tomorrow. That's a tough thing to do. A big thank you from the Community Blood Center. Reports 33 new first-time donors from last week's blood drive, and a grand total of 176 units collected. The goal is 125. Well done. Thank you all very much for that. Remember to send us your mask photos, because masking is the right thing to do. Kathy sent in this video, this photo reminds everybody to vote this November. And Joan sent in this definition of how COVID-19 spreads. We thought it was worth sharing. So, coronavirus explained in craft terms. One person is using glitter, 9 others aren't. But how many other of them will have glitter on their projects by the end? I think you know the answer to that. A whole bunch. I want to thank Scott and Shannon. We've had a lot of great guests on the program today. I just don't think anybody has said it better than y'all did. And so thank you for being on. And Dr. Ranjarajan and Bryce Schill from LMH, two terrific physicians and part of a terrific team of folks there. So, love each other and keep each other safe. I just don't think we can say it better than that. There's no place like home. We're here tomorrow.